When I was in residency at Johns Hopkins, I got a disturbing phone call. It was my mom. And my mom says, your dad just went to the doctor and they say that he has a mass on his pancreas. So I was like, oh man, mass. I said, Mom, are you sure that they didn't say prostate? You sure they said pancreas? Because it has a whole different prognosis. And she says, yeah, no, I'm pretty sure they said pancreas. She did not realize at the time that she was telling me that he was diagnosed with pancreatic cancer, which comes with a 4-month death sentence. So I had to leave residency. I went home and I had to have the hardest conversation that I've ever had in my life. And I had to tell my hero, like the man that showed me what it was to lead my own path, never been sick a day in his life. I had to look him in the eye and tell him he has pancreatic cancer, which has a 4-month death sentence. And my dad's a fighter, you know. I said, so Pop, what do you want to do? He says, well, I'm not going to just lay down and die. We're going to fight this thing. And so we got the best oncologist. We got the best surgeon. And he had this horrendous surgery called the Whipple Procedure. And he was in the hospital for an entire month. He was confused on morphine. And my dad was the smartest guy that I knew in life. And to see him like be confused and not even know where he was devastating in itself. And then after the whole month, the surgeon says, well, we got the entire mass, but there's likely still cancer cells, and recommended chemo. So my dad was like, no way, I'm not doing any chemo. Plus chemo hadn't really shown to add anything to pancreatic cancer anyway. So he says, I just want to go home. So we got him home and I said, okay, so what do you want to do, Pop? He says, well, I still don't want to just lay down and die. I want to do something. So I did some research and I found the Optimum Health Institute in San Diego. And I enrolled both of us in this institute for 2 weeks. We were only able to be there for 1 week because my dad's lungs just started filling up with malignant fluid filled with cancer cells. And I had to get him home and we had to put a chest tube in him. But during that 1 week that I was there, I learned more about health, more about nutrition, more about mind, body, spirit connection, more about the digestive system and how it properly is supposed to work. I learned more about all these things in that 1 week than I did the 4 years in medical school and the 2 years I had completed at the time at Johns Hopkins. And it wasn't like they weren't great programs, they were the best, but they focused on disease care. I remember my father looking up at me and he says, if only I would have known about this sooner. And being a physician at the time, having all this knowledge, I've never felt so helpless because I didn't have anything that I could offer. All I could say was, me too. So it was at that time where I was determined that I was not going to let another person suffer or die because of lack of knowledge.